Hi guys, my name is Kelly Rios and I'm going to do my IV start and IV push skill. So I've been looking over my patient's charts and I see that the physician has put in orders for my patient in room 14, Miss Wanda Chi. So I'm just going to go over the MAR and over the physician's orders just to make sure that everything matches. So Miss Wanda Chi, 920 20XX, 920 20XX, 9 o'clock, 9 o'clock, sorry. Start IV now, Meperidine 50 mg IV push over 2 minutes now. Meperidine 50 mg IV push over 2 minutes now. No allergies, everything matches, everything looks good. So, I'm going to go into my med room and pull my med. And so I'm going to pull the chart up again just to make sure that I'm getting the right med. So again, this is for Miss Wanda Chi. And I need Meperidine 50 mg. So I'm going to go into my Pyxis and grab my Meperidine. So I'm going to look at my expiration date. It's not expired. And this is 1 ml. This is 100 milligrams per ml. And on my orders, I only need 50 mg of Meperidine. So this is enough, and I'm going to take it into my room with all my other supplies. So I have my IV start kit. I have 2 catheters because I only want to make sure I poke my patient twice and no more than that. I'll have somebody else do it after me if I miss 2 times. I have my 2 flushes and I have my extension set. Okay, so I'm ready to go into my room. I have washed my hands. I'm performing hand hygiene. Good morning, Miss Chi. My name is Kelly. I'm going to be your nurse today. Do you mind just verifying your name and your date of birth for me? Miss Wanda Chi, 920 20XX. And that's correct. I pulled up my chart in her room as I talk to her and say my good mornings. And again, I'm going to her chart, Miss Wanda Chi, 920 20XX. Okay. So, Miss Wanda, I'm here because the doctor has ordered for me to start an IV. Do you have any allergies? No, I'm not allergic to anything. Okay, are you having pain right now? Yes, my head hurts. Your head hurts on a scale of 0 through 10, 10 being the worst pain. What's your pain level right now? And she says it's a 9.5. So, okay, so I'm looking at my orders here, and the doctor has ordered for me to give you some pain medication, okay? I'm going to be giving you some Meperidine, and this is just going to ease your pain, okay? It's going to take about 15 minutes after I give it to you. It's going to cause some sedation effects. It's going to kind of slow down your breathing and just make you feel a little dizzy and drowsy, okay? But it's going to get rid of your pain. But before I want to do that and give you that, I'm going to check your vitals and make sure that you're good, okay? And so I get her vitals, and I'm going to go ahead and draw up my med just so that I can have it ready. So I have my chart up, and again, this is from Miss Wanda Chi. Meperidine 50 mg IV push over 2 minutes now at 9 o'clock. So I have my Meperidine, and this is 100 mg over 1 ml. So I'm going to go ahead and do my dosage. So 50 mg, what the doctor has ordered, 100 mg over 1 ml, and I'm going to give 0.5 ml. So here's my drug calculation, and I'm going to go ahead and draw that. So this is a brand new syringe, and I'm making sure to be careful with the tip because I don't want to sterilize anything. I don't want to contaminate anything. I have my blunt needle here. It's brand new, and I'm opening. And again, I want to make sure that all the supply that I'm using is not expired. So I've checked everything. Everything is good to go. So I'm going to pull back my 5 of air. And I'm going to draw up my med. And I'm so sorry. Bear with me. I think I've overused this, so it's kind of slow. I just want to make sure I draw up my 0.5 ml. So that's good. And I'm going to get my air out of here. And of course, it's all the way at the bottom, so I have to get it all the way to the top because I don't want to give my patient any air. And again, I'm sorry, bear with me. The harder I hit the faster this little air gets out. Okay, so that's good. I'm going to close my needle back because I'm not going to take it off until I'm ready to give it. And I just want to show you that I'm at 0.05, and that's what I'm going to give my patient. So I'm looking at my drug, my chart, and this is meperidine 50 mg, 0.5 mg of meperidine. So that's good. IV push over 2 minutes now at 9 o'clock. Okay. So Miss Wanda, as I'm talking to her, I'm assessing her, making sure that she doesn't have any central lines or any PICC lines or dialysis shunts or mastectomies that I need to worry about, and she doesn't have any of that. So I'm gonna go ahead and poke her in her right arm, okay? So Miss Chi, is it okay if I use your right arm here? Yes, it's fine. Okay, so again, like I said, I'm gonna start this IV and I'm gonna give you that pain medicine, okay? Okay, so I am going to open all my stuff up. So my IV start kit, I have my catheter, and I want to go ahead and prime my extension set. So again, being very careful, making sure not to touch anything, I'm going to just go ahead and prime it. So I'm going to hook that up. I'm going to go ahead and hook that up, and I want to get all the air out and make sure that you see that there, and that's all primed. There's no bubbles in there or anything. And I'm gonna want to go ahead and just put that back in the little case like that, just so that it doesn't get contaminated or dirty or anything like that. I have her med here ready to go, and I have my catheter ready to go. All right, so again, she said it's fine to start on her right arm. So I'm gonna go ahead and place my IV 3 to 4 inches above the site that I want to go at. Ooh, gotta keep your arm still, Miss Chi. Okay, so that's on, and I'm going to go ahead and clean my area. She has great veins right here on her forearm, so I'm gonna want to start in the inward and just kind of move out 2 to 3 inches and just clean the whole area there. So while I wait for that to dry, I'm gonna get my tape ready. Sorry. I'm gonna get my tape ready, and it's drying, and I did that very quick. And I got my tape here and everything ready to go, my extension set. And so I'm gonna go ahead and poke her. All right, so Miss Chi, like I said, I'm so sorry I gotta do this, okay? So bevel up. I'm going to want to pull her skin back. And okay, Miss Chi. Big poke, 1, 2, 3, and it's in. And I see a flash, and I want to go at a 10 to 15 angle, the same as my venipuncture. So it's in, and I got my flashback. I take the tourniquet off, and I'm going to go ahead and lock it. But before I lock it, I want to make sure I have my extension set. So I'm going to want to get that ready here. And I'm going to lock it, and I'm also going to want to hold pressure back here just so she won't bleed out. Making sure not to touch the catheter because I don't want to contaminate it. So I'm going to pull this out, and I'm going to get this ready. And I'm not touching any of that because I don't want to contaminate it, and it's in. And I'm going to want to flush it. I'm going to want to flush about 2 ml of it, and what I'm looking for is any type of redness or infiltration or anything like that, because then that's a bad IV and I'm going to have to start all over. So I've pushed it in 2 ml. Everything looks fine. Nothing is, she's not getting red or it's not infiltrating or anything. So I'm going to want to go ahead and tape that down. Not that bad, right, Miss Chi? And she says it wasn't that bad. And so again, I'm going to want to secure this. So again, making sure I don't touch the catheter part of it. So I want to go ahead and put the tape down. Butterfly straight. And then I'm gonna wanna grab my tape here. And then this part here is gonna go over the catheter. But also making sure that I don't put it, that I only put it on the blue part and not the hub part, because I'll probably have to take it off at some point, and we don't want the tape to be in the way. So I've put that down, everything looks good, and so I'm gonna go ahead and take this off, being real careful because for some reason the tape doesn't stick too well to this skin pad. So trying to be real careful. Okay, trying to be as clean as possible. So I'm gonna want to initial and date my little tape here so that everybody coming on before me knows what time and who put this IV on. So KR, and it's 9 o'clock, and it's 9/11/2020. So my initials are there with my date and time. So I put that there, and everything looks good, and she's still hooked up to my flush here because I'm gonna give her med. So I have my chart up, and again, this is for Miss Wanda Chi, and this is 50 mg IV push of meperidine over 2 minutes. So again, I have my 0.5 meperidine, 50 mg, and I'm gonna give it slow. So I'm going to want to flush her IV before I give her her meds, and again, making sure that it's fine, and Miss Chi is fine. Her vitals have went in. Her vitals are stable enough for me to give her this pain medicine. So I'm gonna come here, and I have my alcohol. That didn't fall. I have my brand new alcohol, and I'm gonna take this off, and I'm gonna clean because we want to put this med on a clean hub here. So I'm gonna clean there. Then I have her med here, and I'm gonna take this off. Oh, psych. I'm gonna take this off, and again, it's clean, and I'm gonna give her this. And I've already pushed her, I've already gave her some, I've already flushed it for 2 ml before I'm giving her this. And again, it said to give this slowly, so I'm gonna want to give this very slowly over 2 minutes. It is only half of a milligram, and we want to push at a rate of about a minute per ml, but because the order said push over 2 minutes, I'm gonna do that. I'm gonna push over 2 minutes. So I've given that, and she tolerated pretty well. So I'm gonna come back over here, get an alcohol pad. I've given her that. And I'm gonna clean here, and I'm gonna get a brand new flush. And I'm gonna just wanna flush that again, watching the time, making sure I'm doing it slow, and also watching Miss She, making sure that she's still stable and she's good. And I'm gonna ask her, how do you feel? And she's gonna say she feels fine. So I'm pushing the med, or pushing the flush, and again, everything looks fine, everything looks good. I'm giving about 2 ml flush, everything looks great. So I'm gonna go ahead and take that off, and I'm gonna secure my extension set, and I'm just gonna tape it off to the side. So I have my tape here, and I'm just gonna tape it off. Okay, and that's about it. And I'm again watching for any type, as I did all of that, I was watching for any type of infiltration. So that's how it looks. So I taped it down there, making sure I didn't touch the catheter part of it, and I taped it down, and I initialed in time. And so then I'm going to, again, just let her know that meperidine is going to make her feel a little drowsy, and that she's going to feel a little dizzy. So please do not get up by yourself, Miss Chi. Here is your call light. I'm going to put her bed at the lowest position, make sure that she's safe. Her rails are up, and please call me if you need to get up, okay? I will be back in about 15 minutes and to assess your pain, make sure that you're feeling better, okay? And she says yes. And so I thank her for her time, and I pick up all my mess, and I'm gonna wash my hands, throw away my gloves, and I'm going to document that I put a 22 gauge in the right forearm plus 1 attempt, and that it flushed well, no infiltration, no redness, and that I gave her meperidine 50 mg IV push, patient tolerated well, IV push per doctor's orders, and that patient tolerated well, and that's about it. So thank you so much.